Hello everyone, welcome to Chapter 15, Working Together to Improve Global Health. My name is Dr. Jody Sutherland and I'll be providing an overview of this chapter. This chapter is very dense, so we will not cover every thing, but we'll highlight some of the main points. Again, as always, make sure you pay attention to the learning objectives, as these will help you prepare for the examination. Some global health issues today, when we think about them, they can only be solved through the cooperation of various actors in global health because of their complexity and also their costs, as well as the infrastructure needed to address the problems. These could include, for example, the development of an AIDS vaccine. It's important that global standards in some health fields be established. And in addition to being established, they need to be widely accepted across nations. So transnationally, we need to have really an international health focus that is transnational in nature. It is imperative that these different actors work together globally, again, to try to address these issues, these health issues, in areas such as, again, disease surveillance, particularly when we think about mental health, for example, which is oftentimes not being assessed national or globally, and so we really don't know the statistics on the number of individuals who have a mental health issue, as well as the global fight for increasing standards for some disease control programs, such as TB, as well as malaria. And when we think about cooperation, it's important on a small scale, but then also globally. It's in everyone's interest if we cooperate. It helps create consensus around a cause, so we know our objectives and what we're wanting to accomplish. It strengthens advocacy efforts, and so basically we have people communicating the same message and wanting to see the same type of impacts. It allows for sharing of knowledge, and which is important particularly in our low and middle income countries, so to be able to be transparent and share the knowledge that other nations may have when trying to address a particular problem. Also setting standards, again, trying to be able to go about addressing a problem using a similar method. And many aspects of global health relate to our global public goods, so they have an impact, whether that be on foodways, whether that be on technology, what have you. It also allows for better surveillance if we're cooperating together, and then more effective financing. And we know that financing is always an issue. So this chapter is going to cover key actors in global health, and we're going to find that these are varied and that they each have varied roles, some of them being similar and cross-cutting in nature. So when we think about agencies within the United Nations, there are various ones of those. And they play an important role in trying to address these problems. We have the World Health Organization, for example, UNICEF, UNAIDS, the World Bank, and most high-income countries have development assistance organizations such as USAID, which also play an important role in the health sector. But specifically, when we think about these agencies of the United Nations, again, the most commonly known is the World Health Organization, and when we think about their main objective, it is the attainment of all people with the highest possible level of health. And so we can see that they have this broad agenda that's all-encompassing to try to address these health issues. The next group, we have multilateral development banks, who are key actors in addressing global health issues, such as the African Development Bank. These are often owned by their member countries, and they lend or grant monies to countries to promote economic and social development. They lend oftentimes to these developing countries or countries in transition, whether that be those countries that may have emerging economies. And when we think about these multilateral development banks, we may be most familiar with the World Bank, and it's by far the largest of these multilateral development banks. And they lent approximately $60 billion back in 2009, and the World Bank is actually located in the United States. Has its headquarters in Washington, D.C., and we see that it's owned by 187 member countries. So again, a lot of nations are a part of the World Bank. Next, we have bilateral agencies such as USAID, and they're primarily the development assistance agencies of developed countries. So when we think about these agencies, we wouldn't see these in our low-income countries, but rather in our developed nations, and they work directly with our low and middle-income countries to advance, again, economic and social development. And they may also be involved in things such as advocacy, financing, of course, and then knowledge generation. Next, we have foundations. One of the most common that you may be familiar with is the Bill and Melinda Gates Foundation. And different foundations are deeply involved in global health work. And again, we can look at the Bill and Melinda Gates Foundation as well as the Wellcome Trust. And so they play an important role as well. And these are, when we move into this section here, again, we're thinking more of philanthropic organizations whose goal, again, is to really try to address certain issues. And the Bill and Melinda Gates Foundation has made a huge impact on HIV/AIDS and TB and malaria when we think about their impact. Also, when we think about some of these foundations, there's been some pushback, for example, about equitable investment of monies that these foundations have. For example, a couple of years ago, there was a bit of negative press regarding the Bill and Melinda Gates Foundation because they were investing in some nations, I think it was Africa, and the companies that they were investing in were not green, and so they were exposing the community members to carcinogens. And then there was this higher rate over time, higher prevalence of certain cancers. And so the unintended consequence was that through the Bill and Melinda Gates Foundation investment of their own monies, again, to generate more monies, they were indirectly having a negative impact on communities, because these communities were then being exposed to carcinogens, because oftentimes these nations have looser policies. So companies can come in and have, they don't have to have all of the safeties in place, again, to reduce emissions, air emissions, for example. And so individuals were being exposed. So these are some of the things that we need to just at least be aware of. Next, we have research funders. One of the most widely known, at least here in the United States, is the National Institutes of Health. And these research funders obviously focus on doing and funding research. The U.S. National Institute of Health, for example, again, supports a lot of research here in the College of Public Health. We have someone looking at prescription drug abuse right now. We have someone else with a National Institute of Health looking at sun tanning prevention and skin cancer. I'm working on a grant that's looking at adolescent obesity, and we also have, just for example, someone in the Quillenna College of Medicine that just received $4 million from the National Institutes of Health to look at trying to find a vaccination or cure for hepatitis C. So they do a lot of funding, again, to try to understand particularly disease origin and development of vaccines. Next, we want to move into different non-governmental organizations. Look at these very quickly. We have here BRAC, and it's currently working in several countries In Asia and Africa, these work in the area of human rights and social empowerment, also education and health, and then economic empowerment and micro-enterprise, so local enterprise development. And life skills, trying to train individuals to have life skills. Women and children take priority in BRAC. And back in 2008, they gave $535 million to these different projects. $30 million of that went directly to health or population-based programs, particularly when we think about public health. That's where we would be involved. Next we see here Doctors Without Borders. This is an umbrella organization made up of affiliated groups in 18 different countries, and it's best known for its provision of health services following humanitarian crisis, for example. And they have a commitment to political independence, medical ethics, and human rights. We also have here Oxfam. And Oxfam supports long-term development programs, again in local communities with a focus particularly on women. And they also do some advocacy work on the international policy front, again trying to look at developing policies that are transnational in nature. We also have here Save the Children. Save the Children seeks to contribute to individual and community self-sufficiency. So how can we ensure the safety and well-being of our children? Particular attention is to the well-being of newborns and children, often the most vulnerable, as well as those women of reproductive health, and as well as looking at HIV/AIDS. And this is an organization that's been around for a very, very long time, as you can see here, back in 1932 when it was established. Next, we have another component of non-governmental organizations. We have advocacy groups. And these carry out research and policy studies. And they may be aligned with a specific issue. So they may advocate, again, for equitable access to antiretroviral drugs, for example, to countries who would otherwise be unable to afford them. Next, we have think tanks and universities. And these often create institutes that bring researchers together to work, again, on these global health issues. So we see collaboration. And when we think about ETSU and when we think about this course, we're involved in teaching. We're also involved in research, as some of the projects that I said we were working on, and then practice on global health issues. And we may find, particularly when we think about universities, we may provide technical assistance on different global health projects, bringing in expertise to nations that maybe would otherwise not have those. We see here consulting firms. These can be for-profit or non-profit. And again, these address a range of issues such as management, economics, policy, so on and so forth. And they have particular areas of expertise such as supply chain management, nutrition, behavior change, communications, or social marketing. And then we have special technical organizations, and the best known of these is the CDC, the Centers for Disease Control and Prevention. And they assist with planning and carrying out disease surveillance, which is what the CDC does. And then also, again, technical assistance for disease control. When we think about partnerships related to global health, we can see some partnerships related to the WHO. We have Stop TB, and then also the Rollback Malaria program. So you'll want to read through that. Next, we have other partnerships such as the Global Fund. You'll also be able to read about public and private partnerships. And the aim of these are often to develop new products. When we think about the development of an AIDS vaccination, for example. And then we have some pharmaceutical firms who may donate drugs to global health programs. They may sell antiretroviral drugs for HIV at discounted prices, or they may sponsor programs to address diseases such as HIV and then as well as TB. So we can see that there are many, many layers of actors. And again, collaboration and partnership is so important, again, to reduce redundancy and also to make the best use of our available resources, technical resources, financial resources, so on and so forth. So when we think about now the trends in global health efforts, there's a shift to focus on building capacity. We often, from a public health standpoint, look at addressing the deficits that are there. So we go in with these resources and we try to address deficits. But now we want to try to build capacity for these global public health efforts. Also to develop these health systems, again, linking us transnationally and building policies and programs that bridge the national borders or geographic borders and working together to try to fight some of the common burdens of disease. There's also a family planning shift from focus on limiting family size to focus on general reproductive health. So how can we ensure the reproductive health of, for example, women of reproductive bearing age? Also stressing the importance of primary care where prevention is key. And then greater private sector involvement. So how can we get organizations and companies in the private market to become more involved? And then lastly, we'll want to look at some of the future challenges, which are always important, particularly if you have an interest in this area. So some of our future challenges, again, we'll be able to build cooperation, also to enhance our surveillance programs. For example, how can we better monitor mental health throughout the world? Better focus on the prevention and treatment of emerging and then re-emerging health conditions that we've heard so much about. Working together to strengthen weak health systems, particularly, for example, those in sub-Saharan Africa where there's such a deficit of healthcare professionals, approximately, well in the millions of healthcare worker shortages of primary care, midwives, and nurses. So how can we strengthen these weak health systems? Addressing knowledge gaps and cultural misnomers that prevent our progress in treating certain diseases such as AIDS, TB, and malaria. So how can we get, for example, people to use mosquito nets, which would help ward against malaria, or to dispose of containers and barrels that may sit out in their community that collect stagnant waters? How can we better finance important issues? Again, when we think about the economy of scale, these issues are on a global scale. So how can we finance these important issues? And then how can we ensure good leadership and again, within the global health community? So these will be some challenges that we face over time. As you conclude your reading, be sure to read through the study questions as they'll help, again, link you back to the objectives and also prepare for your exam. Thanks.